Good afternoon and welcome to GP Video Podcast by Nadia. Today we will be talking about chronic pain and use of medicinal cannabis in chronic pain. Because it's a very vast topic, so I might not be able to cover everything in this video podcast, but I would definitely want to shed light on chronic pain. Since I've started working as a GP, as I said that I worked in hospital for 10 years, but I've just last year started working as a GP. Chronic pain is the most common presentation that I have seen. So let's talk about chronic pain a bit. So chronic pain, as I said, is one of the most common presentations in general practice and one of the most common reasons for patients to seek medicinal cannabis treatment. Now, chronic pain can be divided into three main categories. Number one is visceral, coming from internal organs. Number two is somatic, skin and deep tissue. And number three is neurogenic or neuropathic pain. So three kinds of pain. Number one is coming from the visceral organs, like from liver, kidneys, and other visceral organs like internal organs. Number two is skin and deep tissues, somatic, which is called. And number three is neuropathic nerve pain or neuropathic pain, which is related to nerves. According to Bupa, about 20% of adults and up to 80% of Australia's nursing home residents suffer from chronic pain. It is becoming a significant public health issue, estimated to be costing the national economy more than $34 billion each year in treatment costs and lost time at work. The most common reason, accounting for about 38% of all cases, is injury, while 1/3 of chronic pain patients are unable to identify the original cause. Other causes include arthritis, which is joint pain or joint inflammation, musculoskeletal conditions, headaches, cancer-related pain, post-surgical persistent pain, neuropathic pain, and non-specific lower back pain. Also, we have another condition called fibromyalgia, which is also associated with chronic pain. Now, women tend to be more affected than men, and it is usually predominant in the over 50s demographic. Chronic pain is then accompanied by comorbidities including depression, anxiety, PTSD, which is post-traumatic stress disorder, insomnia, and drug addiction. It tends to affect many aspects of patient lives, including mental, emotional, of course, physical, social, and professional. They are often operating in survival mode, feeling worthless and hopeless. Just imagine yourself being in chronic pain all the time, persistent chronic pain all the time. And I'm sure many of us are living in such situation. And it's just a pain, like it's just like you feel like you're worthless, like you feel like, why am I on this earth? And this pain just consumes not only the physical but the emotional, mental, and social and professional parts of our lives. Dealing with pain becomes a full-time job. The usual remedies, so what happens is some of the people who can put up to it, they put up with it, but then some people then go for a cocktail of medications. And of course, if a patient comes to me in the general practice, I'm not going to tell my patient to be able to bear the pain. I would put them on some pain medications that usually starts with a combination of Panadol and non-steroidal anti-inflammatory drugs like Nurofen, Celecoxib, and that kind of group. But then again, you can't be on non-steroidal anti-inflammatory drugs for a long period of time because they can damage your gut. So you can have heartburn and reflux, they can damage your kidneys, and then you can't be on them for a long period of time. Then after a combination of Panadol and NSAIDs, then we come up to opioids, benzodiazepines, and anticonvulsants, antidepressants. So opioids are all of those medications starting from codeine, morphine, endone, Targin, tapentadol, tramadol, and then we come on to benzodiazepines like diazepam and all of those anxiolytic agents. Then we come on to neuropathic nerve agents, which include antidepressants, anticonvulsants, like we have amitriptyline, we have duloxetine, we have pregabalin, we have gabapentin, and all these kind of medications. Then we put patients on a cocktail of medications, opioid pain patches, and whatnot. These do not fully control pain and are often associated with significant adverse effects. For example, number one is addiction. You do get easily addicted to them. Then commonly used opioids, while controlling pain, may cause excessive sedation, dizziness, nausea, vomiting, and or constipation. Patients often report feeling like zombies and being unable to function the way they used to, because they will opioids will sedate you, so you will not feel like you are up and going for for your job, and you're able to do your job like in a very nice manner, because your brain is affected by it. You are sedated. So how, like, people then become used to it and the sedation effect goes away, but again it still affects your brain and it still affects your performance. So the search of pain relief often ends up in dependency and addiction. So now there comes the part of medicinal cannabis. So how does medicinal cannabis work? Medicinal cannabis improves pain by activating CB1 and CB2 receptors, the endocannabinoid receptors that I spoke about, which are involved in pain regulation. It modulates pain perception at the level of peripheral nerves, spinal cord and brain. So both peripheral nervous system and central nervous system, as well as cannabis down-regulates inflammation. Studies reveal that THC and CBD reduce pain associated with some forms of cancer, neuropathy and spasticity. We will talk about it more tomorrow.